Okay, next we're going to talk about nitrates. So a little bit on the pharmacokinetics of nitrates. The duration of action of nitrates, sublingual, SL means sublingual, it's about 10 to 20 minutes. Transdermal is 8 to 10 hours. Okay, so we usually put a sublingual means we put it under the tongue. Okay, so it's going to work for 10 to 20 minutes. Transdermal is usually a patch. We put a patch on the patient. So if you look at this range of hours, 8 to 10 hours, that means that you have to give the patch twice a day, okay, about twice a day. So nitroglycerin, so we have glyceryl trinitrate converting into glyceryl dinitrate. And then, so glyceryl dinitrate is a vasodilator, okay, it's a vasodilator, dilates vessels, and then it gets converted to mononitrate, glyceryl mononitrate, which is much less active compared to glyceryl or glyceryl dinitrate. We also have isosorbate dinitrate, which gets converted to isosorbate mononitrate in the body. And also we have on its own isosorbate mononitrate. And we also have amyl nitrates, okay? So this is not so important comparatively. And we usually institute an 8-hour nitrate-free period to prevent tolerance, okay? 8-hour nitrate-free period to prevent tolerance, okay? Because if they are given nitrates, because nitrate, the issue with nitrates is that it's a drug that patients get tolerance very easy to, okay? They really get it's very easy to get tolerance to this drug. So that's why from time to time we need to institute, or we need to introduce an 8-hour nitrate-free period. Okay, they are free of nitrates, so that we want the effects to be preserved. Okay, so we want the vasodilating effect to be preserved. Okay, according to the duration of action, so we have a very short-acting nitrate, which is the inhaled amyl nitrate, which I have not seen people using it, so I'm not sure whether it's used or not. How frequently, how frequent is the usage? So this is for about 3 to 5 minutes. So this is the most important, one of the most important parts is the short-acting nitrates, sublingual nitroglycerin or isosorbate dinitrate. The duration of action is about for 10 minutes to half an hour. Intermediate, oral, regular, or sustained release SR nitroglycerin, or isosorbate dinitrate or mononitrate. Okay, this one acts for about 4 to 5 hours. So usually it tends to be given about 3 times a day. Okay, about 3 times a day. Long-acting nitrates, transdermal nitroglycerin patch. It acts for about 8 to 10 hours. So the mechanism of action. So we have GTP. So we start with here, nitrates gets converted to nitric oxide. Okay, you get nitric oxide, NO, from nitrates, and NO will act on the guanylyl cyclase, and guanylyl cyclase converts GTP triphosphate to GMP monophosphate, and CGMP will cause smooth muscle relaxation. Okay, so it will cause relaxation in the muscles, including the erectile tissue, okay, and also the blood vessels. And CGMP will be converted by PDE5 into GMP. GMP. So from CGMP to GMP by PDE5. So this will be blocked by giving sildenafil vardenafil and tadalafil. Okay, the PDE5 inhibitors, phosphodiesterase 5 inhibitors. So when you block this, so you'll have more of this available, CGMP. You have more of this available means that you have more blood vessels dilatation and also erectile tissue relaxation. Okay, so you will block this, it will cause more erection. Okay, erection. And obviously, sildenafil is the brand name is Viagra. Okay, so this is Viagra. So we have two categories of drugs here: nitrates, okay, which causes it promotes conversion of GTP to CGMP. Okay, so you promote conversion to CGMP. So you have more CGMP, you have more smooth muscle relaxation, okay, more relaxation of the blood vessels. And the other way is we have blockage of the conversion of CGMP to GMP, so that as a result of this, also you have more CGMP available to act and cause smooth muscle relaxation and cause erection and also blood vessel dilatation. So what are the effects on the organ systems? What are the effects of nitrates? In the cardiovascular system, as mentioned, causes smooth muscle relaxation, leads to venodilation, reduces the cardiac size, reduces the heart size and cardiac output through reducing preload. Okay, so reduce preload, the cardiac output will be reduced because of reduction in preload. The arterial effects, we have increase in flow through the epicardial coronary vessels, which are partially occluded, so which is a good thing, you have more flow. And then arteriolar dilatation, which leads to reduction in the afterload, which will lead to increased in ejection and also further reduction in size. Okay? Increase in ejection and further reduction in size. So we have reduction in preload, reduction in afterload. And venodilation leads to a reduction in the diastolic heart size and hypertension. Arteriolar dilatation leads to reduction in peripheral resistance and the blood pressure. And so this will lead to overall reduction in the hypertension in the heart, reduction in the oxygen consumption, and reduction in the double product, okay, which is a good thing for the heart. In the other organs, the nitrates relax the smooth muscle of the bronchi, the gastrointestinal tract, and the genitourinary tract. However, this is not clinically useful, so this is not so important. Okay. And IV nitroglycerin tends to reduce platelet aggregation. Okay. So platelets, if they aggregate, they might cause blockage. So when you have IV nitroglycerin, the platelets tend not to aggregate that much, okay, which can be a good thing if you want to prevent blockage in the vessels. So clinical uses of nitrates is for acute anginal pain. So we have forms of the drug in the forms of tablet, spray, okay, and as mentioned, tolerance develops after 8 to 10 hours. Toxicity of nitrates and nitrites. You might say some people don't like the word toxicity, so you say adverse effects or side effects or unwanted effects or off-target effects sometimes, or it can be on-target sometimes. Okay. So toxicity of nitrates and nitrites, tachycardia as a result of the baroreceptor reflex. So you get increase in your heart rate. So when you have vasodilatation elsewhere, so your body will compensate by increasing the heart rate so that to compensate for the vasodilatation. And then orthostatic hypotension. So this is a direct extension of the venodilator effect. So veins are being the vessels are being dilated. So from the dilatation, of course, you might get a hypotension, lowering of the blood pressure, and then a throbbing headache from vasodilatation in the meningeal artery. Okay, meningeal artery. Okay, interaction is the drug-drug interaction. So the drug-drug interaction of concern is the interaction of nitrates with sildenafil. Okay, so nitrates versus nitrates. Okay, sildenafil versus nitrates, not good for. So when some patients are on sildenafil for erectile dysfunction, okay, so erectile dysfunction, so their thing cannot become like this. They are like that. This is called flaccid. Okay, their thing, that thing, you know, it's flaccid, so they need to be given sildenafil to make it erect. So this is a problem if they are on sildenafil and we want to start them on nitrates. Okay, again, the same diagram. So when we have nitrates acting on the guanylyl cyclase, converting it to CGMP, smooth muscle relaxation. So what's the effect on the erectile tissue? So we have a greater or increased blood inflow, okay, increased blood inflow. And so in that thing, okay, so if more blood going inside, okay, and also we have a prolonged erection, okay, prolonged erection. Okay, nitrates. So nitrates. So okay, what is this diagram trying to show? It means that you cannot give. So it's a bomb. Okay, you cannot give nitrates together with sildenafil. Okay, this is something that you really have to be aware of. Okay, it's really dangerous to give nitrates to with sildenafil and the other PDE5 inhibitors. So sildenafil, the most famous brand is Viagra. Okay, sildenafil. So in exam, don't write Viagra, write sildenafil if we ask you about nitrate. I'm sorry, about PDE5 inhibitors. Okay, PDE5 inhibitors. So these are different categories of drugs. Remember that. So today we are talking about anti-anginal drugs. Okay, anti-anginal drugs. Sildenafil is not an anti-anginal drug. Okay, sildenafil is for erectile dysfunction. It's not for angina. So please remember that and don't get confused. Okay, we're only talking about this because we want you to be warned that you shouldn't give nitrates together with the PDE5 inhibitors. So nitrates, when given with sildenafil and the other PDE5 inhibitors, will cause excessive vascular smooth muscle relaxation, can lead to hypotension, and can lead to hypoperfusion of critical organs. Okay, the critical organs, the brain, the heart, so the kidney. Okay, hypoperfusion of critical organs. So this can cause, eventually can lead to death. Okay, so we shouldn't give this together. And at high blood concentrations, nitrates causes hemoglobinemia. Okay, so we're not so concerned about this because we don't intend to give MI nitrate. Okay, so we focus today is mainly on nitrates, not so much on nitrites. So nitrites can be given for cyanide poisoning. Okay, so the next category of drugs in treating anti-angina pectoris is the CCBs, the calcium channel blockers. Okay, we'll talk about this in the next video. That's all for now.